Keith, right?
Yep.
So Keith here hurt his finger doing jiu-jitsu. He just got his finger caught up in the guy's gi. And you can see, like, I don't know if you can see that, but the finger is just, the very last digit part is kind of bent a little bit. So the first thing I'm going to do is just going to see what kind of pain level he's got. Does it hurt to do that?
A little bit.
Does it hurt to do kind of side by side?
Tiny bit. Like, it's not like excruciating.
Not so much. So the first thing I want to do is just kind of milk it like this, kind of pull it out, try to distract that last digit.
It really hurt.
And then now that as I'm distracting it, trying to kind of push that joint back into place. Does it hurt more on this side then?
Yeah.
Keith?
Uh-huh.
You put your finger like that, is that going to bug you?
No.
So what I'm going to do is, I use my elbow for everything, but I'm going to use my elbow on this and just kind of break, I'm just going to kind of break up the area on the pinky that's causing him pain.
So you really didn't think the finger hurt that bad, but shit.
Yeah, it's pretty painful. And I'm getting right on that spot that's tender too. But what he's going to feel it kind of being rough and kind of painful at first, and then you'll feel it kind of smooth out and feel better. To the point where it'll still be painful, but not nearly as bad as when I first started. Now I'm going to move up a little bit, hit kind of more the tip, but also on that joint also. How we doing? Hurts a little bit? Okay. So I'm breaking up scar tissue or adhesions or whatever in there. It's also agitating the area, so it brings blood flow to the area. So that's the side of the finger. Now I'm going to go to the top of the finger. Top hurts worse. Top hurts worse, you said?
Mm-hmm.
Okay. You kind of can't hear it, but there's a lot of crunching going on right now. And the more I guess, grind on it, the more you can feel it kind of smoothing out.
It's like slowly starting to fade right now.
Slowly feel better?
Yeah.
Okay. Yeah, it's not the most pleasant experience. But yeah, now it's like pretty smooth.
Uh-huh.
Not nearly as painful, Keith?
Uh-uh.
Okay.
Go to my happy place right now.
Yeah. Does it hurt on the inside too? So if it comes on the inside like this?
A little bit. Not
A
as
little
much
bit, not as
like
much as the top?
the top or the outside, but it's a tiny bit.
Okay. So we're going to work the inside of the pinky also. Right there especially, huh?
Oh, yeah.
Yeah.
It's funny. The first thing that comes before is pinky.
Yeah.
After all the other things I've done to myself.
Okay, that feels better. So now we're going to just kind of do the same thing, just kind of milk it again. But now I can actually feel like the joint.
Oh,
You got a little crack right there, kind of loosened up.
Oh, it's like 100 times better.
Probably feels better now that it kind of released that tension in there.
Yeah.
Now I'm going to make sure and go, can't really see it, but go side by side, your little crack again, just to make sure we get that range of motion restored, and then bring it up and down, kind of go in circles. But you can see like he's not nearly as jumpy and painful as he was when he first started. It's funny because this is pinky, but it's also like the very tip of his pinky too. Much better. Okay, now move your pinky, so you feel
It's like a lot better.
a lot better. You can start.